if you're interested in hearing about food therapy from another great holistic veterinarian out of Southern California, right down the road from where I used to live, then you want to listen to this podcast. And welcome, Dr. Doug Coward. Hey, Dr. Doug.
Hi, Rob. Thank you for having me on the show.
Yeah, I'm really excited to get into this with you. So we're going to talk about your book. We're going to talk about what inspired you into the world of great raw pet food, nutrition, therapy. We're going to talk about all that stuff and your involvement in smaller animals, birds, and all that. But first, we have a couple quick questions from our audience. So we'll just answer those if you don't mind, and then we'll move forward. Does that sound good with you?
Oh, sorry. I've lost it. Hearing. Oh, now I can hear. Yeah.
Cool. Did we cut out or something?
Yeah.
Okay. Let me know if that happens again. But let's barrel forward with do some quick questions here. So first question we have from our audience is, what is food therapy for dogs to you?
Yeah, no, that's a good question. And I have a handout I give every client on food therapy. And it's a combination of eliminating the food we were taught in vet school to feed, kibble, with all the bad stuff it does. It's incredibly inflammatory. And then adding good stuff. And the Chinese and Ayurvedic doctors, have worked this out about 3,000 years ago. So I actually have a food therapy chart based on their teachings. And again, I was clueless. I stumbled my way into vet school as an ecologist. I had planned to be an ecologist. So I'd studied animals in the wild. I was fortunate when I lived in Australia. It's a hop, skip, and a jump to Indonesia, then India, then Nepal, then Africa. So I saw wild dogs and cats and tigers, lions eating, and they ate real food and they looked really healthy. And I was shocked, when I kind of ended up in vet school as a wildlife vet. I was the only student in my class who was going to be a wildlife vet, only to find there were no jobs. My first job was working for a wildlife dermatologist. The first thing he did is he showed me the effect of the food I was taught. He fed it to a bunch of his cats at his clinic, and within a couple of days, they're urinating blood and obstructed. And then he switched the food to what he liked, and these cats cured themselves. And we were taught the treatment for that is, ultimately you amputate the male organ, which is not a pleasant thought at all. So he was the first one to kind of alert me on food. And then the big eye opener was by accident. I was at a winery up in Northern California, family reunion, and there's this healthy dog racing around. This is 1988. And the healthiest dog I'd seen since I was in Africa. And so he belonged to the wine pourer. And I said, God, that's a beautiful, healthy dog. She said, if the stupid vets have their way, he'd be dead. So, of course, my little daughters think this is hysterical and point the finger at me as a stupid vet. So I have to confess. And I asked her, what happened? And so her dog was completely crippled at 4 months, a lab. And her vet, like me, x-rayed and said, this is terrible hip dysplasia, and you should probably turn this dog in, or you're going to have to put new hips in, which is what we were taught. And her breeder was happy to give her a new dog, but they found they were going to euthanize her, so she kept it. And again, in 88, there's no Google, there's no nothing. She heard through the Paso Robles grapevine where she was living, it's horse country, wine country, that there was a chiropractor up in Monterey who had a gift for healing these. So I didn't even ask what she did. I just called her up and she laid into me. She just said, I get them off that stupid food. You stupid vets feed them. And I give them real food like they're supposed to eat and they all get better. And I'm still thinking, how did you get the hips in? And she continued to tell me what a stupid vet I was. But it kind of clicked. I go, well, that sort of makes sense. The wild dogs aren't eating kibble and all that. So I had about 5 dogs that needed new hips and there was a long waiting list. And I called them up, said, I don't know if this will work, but, would you try feeding real food and adding some supplements? And this is amazing, but every single dog I honestly recommended to get new hips was running and jumping in a month and never had surgery and did beautifully. One dog stopped seizuring. Another dog's skin got better. I'm going, this is unbelievable. I have never heard of a drug that'll do this. And I had no resource. So I go into the San Clemente Library and find a dog keeping your pet healthy the natural way. Pat McKay, I believe, was the author, and it listed Dr. Dodds, all these holistic vets, Dr. Goldstein that I'd never heard of. So I hand wrote them my little recipe, and they were nice enough. Dr. Dodds called back. They all got back to me and said, welcome to the dark side. It's a lot of fun. And come to the meetings. And that's how I got started. And then I took a long course in traditional Chinese veterinary medicine to kind of get the science down, because I couldn't tell the difference between turkey and chicken. They're both poultry, yet one made my dog shoot diarrhea across the room. The other made him great. And so after I took that course, it made sense. And the very first patient I treated when I came home had horrible gastrointestinal disease. Been to a bunch of vets, and they rightly so said they needed to biopsy the dog to treat him. They couldn't treat him without biopsying. And the mom just didn't want to put him through it. So I looked at my little sheet, which I was just learning, and put him on turkey and a few colorful anti-inflammatory vegetables, some supplements, and that dog gained 30 pounds and did fine just on food therapy. So it's been the best part of how I treat animals with since 1988. And then supplements like yours are kind of the hard part, because we're never able to get everything at the grocery store. But these supplements are critical to them. And Dr. Dodd said I could continue to add 25 individual products or get a decent supplement. And she had recommended some. Yours got number one, though, in the rating. So Gussys Gut is awesome.
Oh, well, I didn't even know we were in a rating. That's great.
Yeah, no, I Googled, just to do a little more research, and they listed the best probiotics, and you were number one.
Wow.
So congratulations.
Okay. Well, thank you. Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show. Thank you. And thank you for saying that. I appreciate that. I mean, this is the first time you and I are talking, and I am thrilled to hear about this story is amazing. And it's really funny. All these, I talked to tons of vets, and mostly holistic vets, and they're all either affected by some random weird thing like the event that you had at a wine event, or their personal health has been, or the family member has been drastically affected, and they couldn't get their issue fixed with conventional medicine. And so they went over to the holistic side, and they just a whole new world opened up to them. It's very interesting what brings people. It's funny because it's really should be the reverse. We should be starting with this natural way, but yet school teaches us, the conventional way that's, it's a closed loop system. It's proprietary. It's patents, it's obviously pharmaceuticals and such. It's really interesting.
Well, very similar in humans. And I kind of got my first eye opener. I was in Australia. I was all beat up playing basketball, limping, and my landlord dragged me to her yoga class. And it was an Indian teacher from India, and she could live anywhere she wanted after she finished her training. And she said, England's too cold. Americans are beyond help. She'll go to Australia. So anyway, to do a teacher training class, I had to give up meat. And this is in the land of grass-fed great meat. But she started teaching us food therapy then for humans. And there were, 3 different types of food. So I was somewhat aware of it. But then I got autoimmune disease and I fell apart. And I was already vegetarian and I was vegan, and my joints were killing me. I had celiac disease. So food kind of became interesting to me for my own health. It was actually life and death. And it's when I joined a lot of the human groups, the one down in San Diego, Dr. Gurinari's got an integrative health conference she does every year. She saw me as a patient. And I noticed she had a dog under the table that just looked fantastic. I petted the dog. The coat was beautiful. I said, "What do you feed her?" And I could see she was really worried. She knew I was a vet. And I said, "You give her people food, don't you?" And so she nods her head and says, "Yeah." I said, "That's great. That's perfect." And I said, "I'm writing a book and I'm thinking of including people." So she said, "Come to her conference." And her conference was filled with MDs who couldn't get well from their own profession. They go, "Our profession failed us." And the only way they got well was food therapy, outdoor exercise, some type of biofeedback. And then they still do their specialty. These were dermatologists, oncologists, cardiologists, you name it, the best and the brightest. And they said they had no nutritional training that helped them. And same as, in veterinary medicine, it's the kind of the same thing. So you're absolutely right. Both the human and the veterinary side need help in learning the incredible healing powers of food.
Yeah, it's amazing. Let's do our second question, which is related. How does food therapy work?
Yeah, that's a really good question, and it works with I think the whole magic of the biochemistry of the cell. It's a lot of the human doctors call themselves functional medicine doctors because they're going on how the cell actually works. Dr. Billingshurst, your friend, goes right into the mitochondria, the powerhouse of the cell. Keep those things working well, and so it's basically evolution. We were pretty much evolved to eat a certain way at a certain time of the year with certain foods, and our cells are perfectly formulated to do that. And now, unfortunately, in the last 50 years, we are just throwing in food that's unrecognizable and our DNA can't cope. So once we start putting what we're meant to eat, as hunter-gatherers or similar, our bodies are meant to heal and they go right into healing mode. And in my experience with veterinary medicine is I figure 3 weeks is what it takes for people to notice a big difference. And this is like a dog who can't go upstairs when 3 weeks is running upstairs. People, probably the best is, this is a little bit gross, but when I had an Ayurvedic doctor, which was my yoga teacher in Melbourne, she became an Ayurvedic doctor. I hadn't seen her in like 20 years. She took one look, says, "What's America done to you? You look horrible." So anyway, she saw me as a patient. One of the questions she says is, "Do your stools float?" And I said, "What?" I said, "You got to be kidding." I said, "I flush them down." She said, No, you must monitor your stools." And she says, "You look at dogs and cat stools, don't you?" And I said, "Absolutely." And we all know if the dog stools are not right, they'll come to the vet's office. But most people's GI tracts are horribly messed up. And I confess, within about a month of being on the Ayurvedic way of healing, which is food and herb therapy, I have sigmoid snakes that float in the stool. But I'd be willing to bet, 99.9% of people like me pay no attention to what comes out, yet it's vital to their health. And dogs too, if you can heal the gut, everything else gets better. So that's what we focus on in veterinary medicine is, Gussy's gut is like the appropriate title for what we do. We tell everybody everything starts with healing the gut, getting the microbiome right, getting the right amino acids. And if you can heal the gut in 3 weeks, things are better. And I think probably with people in my book, this is not by my own personal, but by studying all these doctors going to the conference, they unequivocally said if a person will change their diet, get outside, in 30 days, they are a new person. And I completely believe that.
Yeah, so do I. Well, it's funny you say 3 weeks because obviously it depends on the dog and the history of the dog. But we usually tell people it takes about 3 to 6 weeks for you to notice something, really impressive on our product, Gussy's Gut. So, and ours works the same way. It's just all food. It's food therapy. So yeah, I appreciate you saying that. These are not quick fixes, and that's the advantage of of drugs. They usually, think of an aspirin, they work within 5 minutes and you go, wow, but these things also come with a cost on the back end.
Well, with a functional medicine, you're trying to get to the cause. And so, to kind of patch it up quickly does nothing in the long run. And ultimately, as holistic vet, that's our goal is, at least for mine, I want to keep these dogs out of the hospital. I can surf longer in the morning. They're happy, I'm happy. And that's the goal, is really to get them healed and stay healed and stay out of the hospital.
Yeah. Yeah. Well, amen to that. Yeah. The best vets I know and the best human doctors I know, they want to free you from healthcare and free you from appointments with them. They have more business than they can handle. All these people are dealing from an abundance mentality, and they're curing people, or people are going into remission, or they are freeing people from their symptoms, and yet their businesses are bigger than ever. So there's this idea that, in conventional medicine, I feel like, where they got to keep, there's a scarcity mentality. You got to keep these people coming back, keep coming back for their, bag of pet food, or keep coming back for vaccinations, or keep coming back for this medication. But it's these great human doctors and veterinarians that they're turning business away. All these great vets have more business than they need, and they have great lives. So hopefully that will inspire any young vets or aspiring vets into holistic medicine, if that's the type of life and practice they want to lead. Third question, what food helps dogs heal faster naturally?
Yeah, if I was to, list them, in terms of the most anti-inflammatory foods that are easy to get, would be ground turkey. That one seems to work best. Eggs are in a category of both anti-inflammatory and for healthy dogs, so those are good too. I'd avoid chicken at any cost, especially the chickens fed so much genetically modified corn and soy. And again, in my own experience, my dogs get chicken kablooey. They plaster the house with diarrhea. So turkey turkey burgers seems to be the easiest and the best. I try to keep it really simple and not make this too hard for families. And so most people can get turkey and eggs. They're just lightly warmed up. It's not cooked like we would eat it, just warmed up. The digestive enzymes, are work best when it's warm. And then we just try to pick some different colors of foods. Each color has different healing properties. So, for example, for green, you can use broccoli, spinach, or kale. For white, you can use little bits of apple or banana, with apple having more anti-inflammatory, anti-cancer properties. For orange, you can use carrots, raw or cooked, or sweet potatoes. For red, you can use like whatever's in season, watermelon, things that I already have in their own refrigerator, hopefully. And then we stay away from grains a lot now, just because so many have been genetically modified. I had to stop eating grains because I had such severe rheumatoid arthritis. I couldn't even lift a file. And it turned out I was very susceptible to the kind of the new world agriculture grains in the eggplant family. So we try to keep that simple. Then we round that out with a great supplement like yours. And the supplement's really important. People are always worried about their dogs getting enough nutrition. So supplements with probiotics, anti-inflammatory herbs, just are incredible, but they have to be kind of whole foods like yours. We don't do too much of the, synthetic vitamins, things like that. And then if they have certain conditions that come in, we have a diabetes diet that's just a little bit different. Kidney diet is exactly the same, just eliminating toxins using real food. We have, a diet for dogs with cancer, which is a little bit stricter. But that's kind of the simplest one, and it works beautifully, to be honest with you. I wish I could take any credit for it. It's just the good old grocery store, a great supplement like yours, in a couple of weeks, and it's like magic.
Well, I appreciate you. I'm going to start. I'll figure out a way to put you on the payroll. You are being too kind. I really appreciate it. The love that you're giving our product. I mean, again, we feel the same way. We can't take credit for it. We took a multiple 1,000-year-old fermentation, The Chinese have been doing it for thousands of years. They figured that out a long time ago. And we do what you're talking about, which is food therapy, polyphenols, phytochemicals. Yeah, you've got the pre, pro, and postbiotics, but it's really not a complicated. We tell people go ferment in your house, go do it on your own. You're welcome to buy our product, but you can also do it yourself. But whatever you do, get a blend of colors, get a blend of nutrients. Don't just do sauerkraut. Get the polyphenols and all of these amazing chemicals that come with these plants, and then you pull them out and make them more bioavailable through fermentation. It's like you're pre-digesting these plants. And so the benefit, tell me what you think about this. The benefit most vets tell us in, say, raw vegetables is about a 5% absorption rate. And when you ferment them, you're looking at, nobody really knows because it depends on the GI tract of the animal and their ability to absorb. But from 5% raw to fermented being 15 to 30% absorption of all of those beneficial chemicals. Would you think that's reasonable? How would you phrase that?
Oh, that is just absolutely fantastic. I think of the microbiome as a whole nother organ. And again, it wasn't even really talked about much until I started hearing the term, maybe 10, 15 years ago. As veterinarians, we were very aware of it. We studied cows, we had a window into a cow at vet school to see how they digest their food. And I had an unfortunate experience, with the microbiome where I was trained in a little bit of everything in vet school. So when I came out of vet school, I'd spayed thousands of rabbits already. So we volunteer and we spay for all the shelters, but we also spay for people, rabbits as pets. And this one couple in Laguna Beach had their whole house was dedicated to rabbits. They have little tunnels the rabbits could crawl through. They played Mozart. They did everything right for the rabbits. And so I guaranteed them I would do my best in surgery and things would go well. And everything went perfect. The rabbit woke up really well. There was not a drop of blood. I go, thank you, God, everything went well. And he was dead the next day. And he sent him home that night, and they were furious with me, ready to kill me. I was ready to slit my wrist. I sent him to UC Davis, and the diagnosis was dysbiosis. And I go, can you run that through me again? And they said, the stress completely changed this rabbit's microbiome for the worse. And he basically died of toxicity from his microbiome going from friendly bacteria to unfriendly bacteria. And what had happened, this bunny had never been around barking dogs, the noise of a clinic. And we gave him pre-anesthetic sedation, pain medicine, did everything I do on thousands of others. But it was a frightening environment. These are prey species, and it's noisy in a vet clinic. And that poor little bunny was in turmoil from the moment he walked in, and his microbiome felt it and changed, just as if I'd given him a toxin. So it doesn't matter how many apologies I gave and all that. I felt so bad for those people. But we changed our protocol for the microbiome at that stage. When rabbits come in, we interview, are they used to being around noise or not? We gave them some probiotics. We put them in a part of the clinic where there was really no other animals. And so we haven't lost one since. But that was an eye-opener on the microbiome. So I got very interested in it, started recommending people really take care of the GI tract, feed that microbiome. We do harm with antibiotics. I send them probiotics with every patient after that, and would talk, long and hard about the quality of care of the GI tract, which is basically food and then supplements. You needed them both. It's a 1-2 punch: the healthy food from the grocery store, and then a great gastrointestinal supplement. And that's made things much better. And now everybody hears about the microbiome, but still every day I get 5 patients, and they're really good families, good owners, smart, but they're on kibble. Their dogs have upset stomachs, diarrhea. And they go, why didn't anybody tell us this? And, I have to kind of go, it's not the vet's fault. That's what we're taught in school. I said, I came to vet school from an ecology standpoint of view. I'd seen wildlife, so I was open to it, but it's not their fault. That's what we're all taught. So it's
Yeah.
hard. This day and age, I get every day patients who know nothing about the effect of the bad food, the kibble on them, nor about the importance of the microbiome.
That rabbit story is a great story. Rabbits are famous, well, infamous for, I mean, they can have heart attacks with enough stress,
Yeah.
and we all know that. But I'd be curious to just take that story over to dogs. Do you feel like we talk a lot about like stress in dogs, boredom being a microbiome killer, lack of fulfillment of their drive. So the breed of the dog, if they're, let's say, a border collie and they're not getting exercise and they're not satisfying their brain, um, genetically given brain, do you feel like that's a slow, degrading, or like, I think killer is maybe a strong word, but it degrades the microbiome, even just
Yeah,
boredom.
absolutely. Yeah, you're 100% correct there. Now there's a lot more. There's a book called The Longevity Dog that came out a year or two ago that was really great. But they said a dog can smell our stress when we come home, and then it makes them stressed. And so just our stress is enough to upset them. But, I used to live in Queensland, Australia. There were these Queensland healers, and they would be herding these Brahma bulls all day long. They were just meant to work, and they loved it. And you get one of those as a pet and put him in an apartment, he'll go psycho, and his microbiome will too. You end up with the house ripped up or the apartment and diarrhea everywhere.
Yeah.
And they just need to do their job and get the food they're meant to eat. And every dog is similar. I think they all have a job. They like their job, they need to do it, and then they're like us. They're meant to be out 8 miles a day running or walking in the fresh air early in the morning. And then they need real food and real probiotics, prebiotics to thrive. So you're 100% correct there. Dogs, cats, birds, uh, they all show the same symptoms. They get stress, and the stress affects the intestinal little gaps. They open up, and they end up stuff that shouldn't leak into the bloodstream leaks in. And the mind gut relationship is well known now. There's tons of books written on it. So really, you have to keep the guts healthy to heal the brain, and the brain healthy to heal the guts. It's all, that's why I came from ecology. In ecology, everything is interconnected, and that's the mindset I took into veterinary medicine. Everything's not separate. All these organs are connected, the cells. And so we try to heal the whole body, but it all starts in the gut.
Yeah, it really does. And wasn't it? I think maybe Hippocrates that said health begins in the gut. I think it was him that said that. And then or maybe Socrates, sorry. And then I think the Chinese also have said for thousands of years, death begins in the gut. Nobody likes to talk about that one.
No.
It's not the right phrasing. So, but I think both are good. They're bookends to each other. Of you can either have this or you can have this, and that's what's led me into this line of work. It is so fundamental, and if you can get that right, you can get a lot of other things right. But until you do, you're just lost. You're grasping at straws, and you're trying to address symptoms when in fact it's this root cause of your dog's getting ultra processed, rancid oils, bad ingredients, the herbicides, the pesticides that are in the lentils and in the meats and the hormones. I mean, it just goes on in the ultra processed diets. There's almost very little good things you can say about an ultra processed diet. So, but I appreciate that. So when you mention a book, I think you said something about longevity for dogs. Is that Dr. Gary Richter's book?
Oh, pardon me?
Well, that book you mentioned a second ago about longevity for dogs, is that Dr. Gary Richter's book?
Oh, I should know, but I can't remember. It's written by Dr. Karen. I forget her last name.
Karen Becker.
Becker, yeah. Yeah,
Okay, right.
it's a
Forever
fun
dog.
book, but very scientific,
Yeah,
and
yeah,
yeah, I enjoyed that. Learned a lot from it. Uh,
yeah,
with
yeah. Dr.
with
Karen
life,
Becker and Rodney Habib.
that's yeah. Excuse my senior brain here,
No,
but
no, that's great. That's awesome.
that's the
So I
reason
want
I
to.
kind of wrote mine. Sorry, go ahead, Ron.
Oh, no, no, no problem. I'm sorry we have a bit of a delay in this broadcast, but I do want to talk about your new project before we go. It's more about the human world. So tell us about the project you're working on because I really think it's fascinating.
Yeah, well, for years, clients would say, can you write a book on the food therapy? Because, the food works and people would be amazed. And some of their friends would believe it, some of them wouldn't. And it was, they say we just need it in a book form. And so I thought, okay, I'll do it. But about that time, that's when my health was failing with autoimmune disease. And a lot of clients were seeing how dramatically their dogs, cats, birds, rabbits improved. And they say, well, this worked for humans too. I knew, just a little bit from back in the late 70s going on the Ayurvedic diet from a yoga training class. But I
Yeah.
intimately knew now that if I ate the wrong food, I was crippled. Food really was making a difference for a lot of times for worse in my life. And I was eating so-called healthy foods. So I decided to try to get my own health back by diving into the human world. And, I've got a lot of MDs in my family. My brother's an orthopedic surgeon. I've got a cousin who's a cardiologist, another's an oncologist, a niece who's a surgeon, on and on. But when I ask them, what percentage of doctors are healthy, they go, not many. They listed around 20% of MDs are healthy. And they say, not the best advice from, if you're in an accident, they're great at putting you back together. But as far as being healthy, so that's when I joined Dr. Gurnari's group and, got my eyes open there. And then I'm in the very esteemed Surfers Medical Association, a bunch of surfers who gather once a year. We surf and then we share our research. And so I've been
Nice.
sharing mine for years. So I finally finished. It took me 7 years to write. A lot of it's my failures on my own health, doing everything wrong, trying to play basketball in college and major in biology and not sleeping and wondering why I never healed. And then the wrong foods at the wrong times, not stopping eating at 6. I've got a manual of things not to do that I did on my own health. And here I was trying to be a pro basketball player and I was damaging my health. And autoimmune disease is rampant. It's everywhere. The last
Yeah.
meeting I talked about, an MD comes up and says, my 22-year-old daughter has 7 autoimmune diseases. Nobody's ever mentioned food. I said, oh, geez. I said, the whole key to autoimmune is to heal the gut, is that I found,
Yeah.
and get rid of parasites and other things. And so I felt really sad that so many are suffering. I suffered in lots of pain. And I've got lots of docs in my family. My brother would go, your x-rays look fine. I go, I know, Dave, but I can't lift my arms. And,
Mm.
he's in a narrow box. You need a hip replaced. He's the man, or a knee replaced, but says we just don't have the training. So I thought I'm going to try to write a simple book, really just stories, because that's all I do in the exam room. I never tell them how many percentage of protein or this to eat. I go get turkey burgers. And then try to, also sum up the difficulty people have getting rid of their food addictions. And, I love food. I used to eating at 10 or 11 at night. I'd come home from work. That is stupid. And my
Yeah.
wife would say, this granola you love, it's all sugar. I go, no, it's health food. So I figure I could help a few people out there by including the human part. But if I had to summarize it, it's, don't feed your dog kibble and don't eat Doritos and heal your GI tract and life will be much better.
Yeah. Or cereal.
Right.
Yeah. Yeah. That's pretty much what I think of kibble. I think it's basically just cereal. It's a cereal diet. It has some things that qualify as protein and fatty acids on a scientific chart, but the digestive tract doesn't absorb it as well, doesn't recognize it as well. One thing you said I liked at the beginning of this is, you know, does your body recognize these things? And people are now turning to supplements in the pet world. We see this where they're turning to supplements more than just really good fundamental nutrition. You can't supplement your way out of a, you know, paper bag, as they say. You can't add supplements to a really crappy diet, and you'll sustain life possibly, but you will pay for it in the form of a degenerative disease or pain or lack of energy, you know, mitochondrial health that you mentioned. Do you agree with that?
Yeah, absolutely. Um, it's so simple. It's hard to believe that really just our bodies are meant to operate on something very simple, and everything that's sort of synthetic, the body has trouble often recognizing, and then there's side effects down the road from that. So, you know, simple really is best, and there's a little science behind it, not a lot. So occasionally I'll get someone who comes in and they've gone to a veterinary nutritionist. They've done everything right, and they get 10 pages of handouts, and they're supposed to measure something on a gram scale. And I go, I wouldn't even do that. It's just too complicated. So, you know, the simple way is the best. My first boss, you know, was lucky. I did a internship with a guy who was a exotic animal vet, a zoological vet, a dermatologist, an allergist. And there's a right way, the wrong way, the UC Davis way, and my way. We will do everything my way. And food was a big deal for him. And his practice, you know, he said, you know, we do everything the KISS principle. I had to ask what that was. And the text said, well, let's keep it simple, sweetheart. He really means keep it simple, stupid for you, but he's too nice to ask. But he would try to make everything simple. And the number one thing he always did is he would change all these itchy dogs' diet immediately. And he didn't really believe or think people would do the homemade cooking. But I found out just the opposite. People will do the homemade food, and if they get a good supplement, it's dramatic results. The body knows what to do with what it's meant to have. And I was lucky to see some cultures in the highlands of New Guinea. I saw the hunter-gatherers. They're all lean and muscular. In Tahiti and Fiji, same thing. They all eat what they get. And since the 70s, you know, as I traveled a lot in those days, people were lean and muscular. Now the whole world's obese from our sad diet that's been spread all over the world. I feel sorry. These kids, they get their health sabotaged, not knowing that what they're eating is not what their body wants. They're getting fatty liver, cancer at a young age. So I'm hoping if my book will resonate with a few, they'll go, okay, maybe our bodies are meant to be eating these foods. Maybe these foods are the cause of the harm. And by eating what our grandparents ate, they can heal. I'll be worth the 7 years I spent agonizing over this book. So it'll be done in a few months. It's being edited right now by my 89-year-old ecology professor at Santa Clara, who's also a book editor. And then it'll go to a Simple Press, and I'll email out, pay people to read it.
That's awesome. Well, I'm excited. I'll be one of your first readers, and I'm excited. What do you calling the book?
Well, until I met with my editor last week, it was called Care of Both Ends of the Leash, about ancient wisdom, modern medicine, and loving kindness, the effect on healing. And my editor said, you better call it the Accidental Veterinarian's Guide, because I'm really a vet by accident. Last thing I want to do is be indoors all day working with, I remember meeting a wildlife vet in Nepal, and he said, I don't want to be a Paris vet working on pampered poodles. He worked on elephants. And I go, God, that'd be awful to be stuck inside all day with poodles. But that's what I do, and I love it. I never would have believed, but the only way I can cope is I surf for an hour in the morning, get out in nature, and get exercise. And then it's the most wonderful job in the world to be helping animals get better. So I've been very lucky in my accidental profession. Most of my classmates, they knew they wanted to be a vet when they were in the womb. And I think I was 27 when I applied to vet school and started at 28. So I had again, a little different approach and mindset, and tried to create a wellness center at our clinic when we first started in 1991, and making our goal to keep pets well, basically with diet and supplements. So it's been a fun, still practicing, still fun.
Yeah, amazing. Well, for anybody interested in getting on your email list for your book when it comes out, or if you're in the northern San Diego region, Orange County area, Dr. Doug is in Mission Viejo, and I know the area well. And your website, Dr. Doug, is ABC, like the alphabet ABC, of MV for Mission Viejo.com, ABC of MV.com. And if you're in the area, take your dog to see this man, and you'll get him after a surf. Get him after a nice surf, his meditation and his exercise in the morning, and then get a new perspective on your pet's health. Go see somebody like this. And Dr. Doug, it's been great to get to know you a little bit. And again, thank you for the nice, kind words on our product. And I look forward to handing your book to Dr. Billinghurst. I know he's going to be excited to read it.
Well, I'm so grateful for what you did, because again, our whole practice really centers on healing the gut. So you've made that much easier. So thank you, Rob. I really appreciate your hard work, because that's what you've done is a lot of science and hard work and labor of love. So many, many thanks to you. And thanks for having me on the show.
I appreciate that. Thank you, everybody, for watching. And we'll have you back on, Dr. Doug, pretty soon. So we'll talk about a lot more. Way too much stuff to go into in an hour. Have a great day, everybody.